innervation nerve. And we already talked about the innervation of the auricle previously. Now, moving on to the very important topic, and that topic is actually going to be splitted to another video. Okay, so here we're gonna start talking about part 2 of our ear, which is the middle ear cavity. So what is the middle ear cavity? It's the middle part of your ear. The middle ear cavity is actually a biconvex. Why do we call it biconvex cavity? Because it has a convex surface from the lateral wall of it, which is your eardrum, and it also have a convex part because of the promontory of the trochlea. All right, so if you think about your wall, you have a convex part from here and from there. That will end up giving you a 2 millimeters thickness of, can you imagine how teeny tiny is the middle ear cavity? Okay, now how will you orient yourself about the walls of the middle ear cavity? Because it's a very important topic in anatomy. It has a condensed information, but we're gonna simplify it, and we're gonna memorize it together. All right, but how will you orient yourself on the walls of that cavity? Now, imagine that you are standing inside the middle ear cavity. You have a lateral wall, which is related to your ear, you guys. This is the lateral wall here, which is actually the tympanic membrane. And the medial wall is actually what takes you to the medial aspect of your head, which is basically your inner ear. Okay, so this is very simple information and easy. All right, so lateral wall is the tympanic wall, and the inner wall is the wall that is related to the inner ear. All right, now you have a superior wall, which is above, what separates you from the middle cranial fossa, and we're going to talk about that. And you have a floor or inferior wall that is basically going to take you to the internal jugular vein. It's going to be right down to you, which is the internal jugular wall. So in that case, we call it the jugular wall. And then posterior to that, to you standing in here, it's going to be the mastoid wall, and we're going to talk about that. And in this picture, the anterior wall is removed, so you can see the walls of your middle ear cavity. Now let's dig deeper into the middle ear cavity and see what are the walls once more, and how can we understand it and memorize the structures related to it. First of all, we have the medial wall. And the medial wall is related to the inner ear. This is very simple information because that takes me to the inside. And you guys know that medially is the next stage, because outside is lateral. And outside is the tympanic membrane. This is your lateral wall. But the medial wall is actually your inner ear. And the inner ear is the labyrinthine wall. It's related to the labyrinthine structures here. So we call it labyrinthine wall. This is the inner ear. Now, if you look at this box that you get to see it in anatomy books, you will find that in order for them to explain to you the structures that are related to the middle ear cavity, they've removed the lateral wall. Why? Because you guys, the lateral wall, the superior wall and inferior wall, they have nothing to specific about them, other than there is one important thing. Based on that, we gave the name of the wall, and we're going to talk about that. But remember that the most important walls of the middle ear cavity are the medial wall, the posterior wall, and the anterior wall. And we will simplify them in such a way you will remember everything related to them. All right, other than that, there is nothing important. That's why when they teach the middle ear cavity, you will find them removing the lateral wall, because it has nothing important other than the eardrum or the tympanic membrane. So we need to remove it so that we can see everything else in the middle ear cavity. Now let's start our talk about the structures with the medial wall. What does the medial wall have? The medial wall is the labyrinthine wall. It's related to the inner ear. It is related to the organ of hearing. So I have two windows, two canals, impressions of two canals, and the promontory of cochlea. Remember that I told you that the middle ear cavity is abiconvex because it has a bulging of a cochlea from the medial wall. So this is the promontory of cochlea, and on top of that, you have the tympanic plexus that is formed by the glossopharyngeal nerve and also from the internal carotid plexus. Okay, so the promontory, it has on top of it the tympanic plexus of glossopharyngeal nerve. Check. Now, what are the two windows and what are the two canals? Think about them. You have a bulging impression from the lateral semicircular canal. This is making an impression on the medial wall. So one canal is by prominence of the lateral semicircular canal because the anterior and posterior, they don't contribute to the walls. And we have the fascial nerve canal. The fascial nerve, in order for it to exit from the cranial cavity, to get outside of it, it needs to run through a bony canal. That canal has two parts, one part related to the medial wall and another vertical part related to the posterior wall. So the two canals impressions on the medial wall are for the lateral semicircular canal and for the fascial canal. All right, and the promontory is for the cochlea. Now, what about the windows? You have the oval window and you have the round window. This is where you are going to take the sound waves all the way to the inner ear, get it processed inside, and it comes back to push against the round window. So it enters from the oval window and it bulges into the round window. All right, so basically, this is the communication between the middle ear and the inner ear because this is the medial wall. This is the wall that takes me, and this is my door to the inner ear. So it makes sense that it is related to the oval window and the round window. And we're going to talk about what happens as we process the sound waves from the middle ear to the inner ear as we proceed. But for now, it makes sense that we have a bulging of the structures in the inner ear because this is the medial wall. This is the labyrinthine wall, which is the promontory of cochlea. And on top of that, we have the tympanic plexus of the glossopharyngeal nerve and a branch from the internal carotid plexus. All right. And we have two canals, one part of the fascial canal and the impression of the lateral semicircular canal, and then we have two windows, the oval window and the round window. All right, this is all in the medial wall. Now, moving on from the medial wall, it's basically the lateral wall. And as I said, it's very simple information, as the lateral wall is formed by the tympanic membrane. Okay, this is the tympanic membrane, and we don't have it in this box because it has been removed. Now, next to that is the tegmental wall. Let's finish the simple walls. The tegmental wall, why do we call it tegmental? Because it is formed of something called Tigmen tympani. What does that mean? Tigmen, you guys, in Latin means a cover. And because this is the tympanic cavity, so we have a cover to the tympanic cavity that separates the middle or the middle ear cavity from the middle cranial fossa. So this is actually what we call the tegmental wall or the Tigmen tympani. All right, we don't have important things to say about that other than you need to know what is the name of the wall, and it makes sense that the tegmental wall is the roof of your cavity and this is the cover of your tympanic cavity, which is the middle ear cavity. It's basically your Tigmen tympani. All right, now what about the jugular wall? It is your floor. It's basically the bone that separates your middle ear cavity from the internal jugular vein. So you only need to know that your floor is your jugular wall. Now, because here your internal jugular vein is down. All right, now we have the posterior wall, which is very important and it has important structures. And we have the anterior wall. Now, what is the posterior wall? The posterior wall has letter S. So this is the mastoid wall. All right, it has the mastoid air cells in that bone. All right, it's actually the posterior wall. Now, the anterior wall, it's the carotid wall, carotid artery. It's related to the artery. So anterior wall is related to the to the carotid artery, the internal carotid artery. Now, these walls are important and they have important structures. They are as much important as the medial wall that we just talked about it. Other than that, the other walls, they don't have important structures. Now, how can we memorize the structures related to them? Now, for the posterior wall, think about it, you guys, as the posterior wall is related to one canal, one muscle-related structure, the entrance of chorda tympani. All right, because these things are exactly there in the anterior wall. All right, when we're going to talk about them in the anterior wall in a bit. All right, now I have a canal. What do you think the canal would be? Actually, the medial wall, which is related to the inner ear, is so much related to the posterior wall. So because the facial canal was there and the facial nerve was exiting from the cranial cavity and doing this canal, I have a vertical part of the facial canal, and that is related to my posterior wall. All right, so the posterior wall is so much related to the medial wall. If I have here facial canal, so I also have here facial canal. So that the canal part of the posterior wall is check. Another thing is one muscle related. What do you guys muscle we would think about that you have them in the middle ear? You guys know that we have muscles that are very important if we have a very loud voice sound, I mean, and if we want to kind of reduce the oscillations of the middle ear bones, yeah, and we need these muscles to get attached to the first bone and the last bone of the three bones of the middle ear. All right, one muscle related to the stapes, and we call it the stapedius, and one muscle that is related to the incus, and we call it the tensor tympani muscle. All right, now what do they actually do? They dampen the sounds and they reduce as they contract, they kind of reduce the oscillations to try to protect the ear from the very loud sounds. Okay, so these muscles are the stapedius and the tensor tympani. And I told you guys we have posterior wall and anterior wall. So if the posterior wall has a muscle, which is actually the stapedius attachment of stapedius muscle is to the pyramidal eminence. We have something called pyramidal eminence. It's an elevated part on the posterior wall that gives attachment to the stapedius muscle, and the stapedius muscle will be attached to the stapes. All right, so the stapes is going to be attached to the stapedius. And what do you think the innervation of that will be? It's the facial nerve, yeah, because facial nerve is here. It's going to give the innervation to the stapedius, right? So we have one canal, facial canal. We have the pyramidal eminence, which gives the attachment of the stapedius. So this is one muscle-related structure. We have a chorda tympani, which is the nerve that gives the taste sensation of your tongue, anterior two-thirds of the tongue. It will actually traverse the middle cranial, the middle ear cavity. The chorda tympani, it traverses the middle ear cavity. It comes out from the facial nerve, it traverses the canal from the posterior wall, and it exits from the anterior wall. So if I have the entrance on the posterior wall, I have the exit on the anterior wall. Okay, so this is the story of the chorda tympani. The last thing is actually one structure, and that structure in the posterior wall is the adductus to mastoid antrum. Remember, guys, actually this is a posterior wall, right? So the mastoid wall, the posterior wall is the mastoid. So if you look at the do I have a picture? I mean, this is the only thing. Adductus means it's the entrance to the mastoid antrum. It's what takes you to the mastoid air cells inside. Okay, so this is the last structure we have in the posterior wall. So again, the posterior wall, it has one canal, one muscle-related structure, entrance of chorda tympani, and one structure. The canal is the vertical part of facial canal. The muscle related is the pyramidal eminence that gives the attachment to the stapedius muscle, the entrance of chorda tympani, and the structure is the adductus to mastoid antrum, because this is mastoid wall. Now, what about the anterior wall, and how can we relate the information we've already memorized to the information here to make our life easier to remember any question in the exam? All right. This is basically by that we have the same thing. Okay. So I came up with this description to make it easy for you to relate the information and memorize them. We have one canal also. We have one muscle stuff. We have the exit of chorda tympani, and we have one structure. What would the canal be? You guys, this is the carotid wall. So what would be the canal? It's the carotid canal. Okay, so the canal that we have it in the anterior wall is the carotid canal. What about the muscle? We don't have more than two muscles. If the first muscle is getting its origin from the pyramidal eminence of the posterior wall, which is the stapedius, then the muscle that is related to the anterior wall is actually the tensor tympani. Done. What about the exit? It's for the chorda tympani. We already memorized this information. So the chorda tympani enters and traverses the middle ear cavity, and it enters and it exits from the anterior wall. So the exit of chorda tympani is there on the anterior wall, and the last structure is the pharyngeotympanic tube. It's a very important tube. And if I told you guys that we don't have anything important in all of the walls, all right, and I told you that everything related to the medial wall is related to the inner ear, and you memorized everything in the posterior wall, and you memorized everything in the anterior wall, and you have a last thing that you need to know, it should be the pharyngeotympanic tube, because I need to have a tube that has a communication between my middle ear cavity and my nasopharynx to equalizes the pressure and to protect my tympanic membrane from rupturing if I have a change in the pressure, right? Because actually the pharyngeal tympanic tube is actually closed. It's in normal circumstances, this tube is actually closed. It only opens whenever we want to equalize the pressure. And we're going to talk about that as we proceed. So let's recap, all right? Let's recap and remember, what did we actually say about the middle ear cavity? So the middle ear cavity is a biconvex structure. It's 2 millimeters thickness. It has walls, one that is above, and that is what we call the tegmental wall, because the name tegmen tympani, the name tegmen means a cover. So this is actually the roof of the cavity. You have a jugular wall that is the floor of your cavity related to the internal jugular vein. You have the lateral wall, which is actually removed, and this is actually your tympanic membrane. Other than that, you have a very important medial wall that separates you from the inner ear. You have a posterior wall, S, that is actually your mastoid, related to the mastoid. Can you guys see the mastoid process? Can you see the mastoid air cells are there? All right, so this is actually in the posterior wall, and the anterior wall is actually related to artery, the internal carotid artery. So A and A, and the internal carotid. So this is the carotid wall. Now you have the anterior wall. Remember that we had one canal, one muscle, the exit of chorda tympani, and one structure. The canal is the carotid canal. The muscle is the tensor tympani, because we have only two muscles, one related to the anterior wall and one related to the posterior wall. And the anterior wall is actually the tensor tympani. And then you have the exit of chorda, and then you have the pharyngeotympanic tube. And then you have the posterior wall, which is the mastoid, SNS. You have one canal, one muscle related, one entrance of chorda tympani, and you have a structure, and the canal, because they are related together to the medial wall, it's the fascial canal. All right, and muscle related, we already talked about the tensor tympani in the anterior wall, so that's gonna be the pyramidal eminence that gives attachment to the stapedius, and the stapedius is gonna be attached to the stapes. All right, and then you have the entrance of chorda, and then the structure is actually, this is posterior wall, so it should be the adductus to mastoid antrum that takes you to the mastoid air cells. So remember, this is structure, and that structure is related to the name of your wall. And also we had in the anterior wall a canal, and also the name of the canal is related to the name of the wall, which is the carotid canal. All right. And the medial wall was related to the inner ear. So we have promontory of cochlea, and on top of that we have the tympanic plexus from the glossopharyngeal nerve, and it gets also innervation from the internal carotid plexus. and we had two canals and two windows, one for the facial canal, for the facial nerve, and one for the bulging of the lateral semicircular canal. Okay, because we have anterior, all right, I'm trying to draw. We have anterior, we have posterior semicircular canal, and the only one that can bulge into the middle ear cavity is the lateral semicircular canal. So this is the bulging one here, and the two windows are actually the only windows we have them, the only communication for the sound between the middle ear cavity and the inner ear. They are the oval window above and the round window below, and we're going to talk about that as we talk about the transmission of sound. Now, what would be the innervation? We already talked about that in the medial wall. It's basically the tympanic plexus, and as I said twice or three times by now, it is formed by the glossopharyngeal nerve and the tympanic branch of internal carotid plexus. So what do you think the innervation of the eardrum would be? The inner surface? It is glossopharyngeal nerve, because this is what you have in your middle ear, right? Now, the tympanic membrane